Okay. My name is Dr. Campbell with DC Strategies. Thank you for joining us for this webinar on House Bill 300 and HIPAA. The webinar should last about 30 minutes, and then if there's any questions at the end, please go ahead and type them in the chat box. And if you have any problems during the webinar, please also type those in the chat box. Okay, this is a new law that went into effect on September 1st, House Bill 300, and it's requiring all covered entities to go through a training on HIPAA and House Bill 300. And it also has expanded what a covered entity is. Now, you should have received via email earlier this morning a sign-in sheet. Please have everybody in your office that is in attendance fill out the sign-in sheet, and if the doctor or office manager would, at the bottom left-hand side of that sign-in sheet, please put your name, your autograph, and today's date, certifying that everybody listed above was in attendance at this webinar. And return that to our office either by fax or email, as instructed in the email earlier today. That way we can verify and return it with the certificate of completion of this the training for this webinar. Let's look at HIPAA. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act, which is a federal law that specifies administrative simplification provisions that protect the privacy of patient information, provide for electronic and physical security of patient health information, requires minimum necessary use and disclosure, and specifies the patient's rights to approve the access and use of their medical or health information. Under federal law, under HIPAA, covered entities are people like physicians, doctors' offices, hospitals, and other healthcare providers, health insurance plans, healthcare clearinghouses, and billing companies. Indirect and direct applicability to business associates of covered entities, including attorneys, imaging centers, laboratory facilities, cleaning crews, IT support, and so on. Now, this is federal. In contrast to House Bill 300 in Texas, now everybody that comes in contact with patient information is going to be considered a covered entity. So what do we have to protect as a covered entity? We must protect an individual's private health information, which is collected or created as a consequence of a healthcare provision. Private health information is information that's related to a patient's past, present, or future physical and or mental health condition. Can be in any form, written, spoken, electronic, including video, photographs, and x-rays. And it includes at least one of the 18 personal identifiers associated with the health information. These rules apply when you use and share or even view private health information. Any health information with the identifiers on the following page is considered protected health information, or PHI. Here are the identifiers. There's 18 identifiers, which include the name, postal address, all elements of the date except for year, the telephone number, fax number, email address, URL address, IP address, social security numbers, account numbers, license numbers, medical record numbers, health plan beneficiary number, device identifiers and their serial numbers, vehicle identifiers and serial numbers, biometric identifiers, including fingerprints and voice prints, full face photos or other comparable images, and anything else you can think of that is unique in identifying number, code, or characteristic that can be related back to that patient. Now, there's an absolute prohibition from release exceptions. It is okay to release patient information for treatment, payment, or healthcare operations, commonly referred to as TPO. It's okay to release the patient's information to themselves. It's okay to release information with permission of the individual, or as required by law, or other specifically allowed uses. Every covered entity must have a right to notice of privacy practice, which describes the individual's right to access, inspection, and accounting of their health information. It outlines the duties of a covered entity. It also outlines the complaint process and divulges contact information for filing a complaint against the covered entity. It outlines how a covered entity will use and disclose a patient's health information. States that the information cannot be used or disclosed for any purpose not included on the notice. And the individual must be notified if information is used in a new fashion not covered by the notice that they received. Covered entities must maintain administrative, technical, and physical safeguards to protect the confidentiality, integrity, and availability of protected health information in electronic format that they maintain or transmit. Each covered entity also has administrative duties, such as to appoint a privacy officer and security officer, to have and maintain HIPAA policies and procedures, to train your employees, to document compliance and complaints, and to perform a risk assessment of their office. The HITECH Act updated the HIPAA Act in 2009. So if your HIPAA manual and program was purchased prior to 2009 and it has not been updated, it is not in compliance. As a part of the American Recovery and Reinvestment Act of 2009, the Health Information Technology for Economic and Clinical Health, otherwise known as HITECH, updated federal HIPAA privacy and security standards. These updates included new breach notification requirements, increased fines and penalties for privacy violations, added the right for the patient to request copies of their electronic healthcare record in electronic format. And it mandates that business associates are civilly and criminally liable for privacy and security violations, whereas before they were not. Now there's something called the Hyde Rule that states that if a patient pays in full, out of pocket for the services rendered that day, and requests that the provider not disclose the information to the patient's insurer, the provider must comply and not disclose the information unless the information is for disclosures for payment or healthcare operations. Fines and penalties under federal HIPAA law. Well, there's both criminal and civil penalties. Criminal penalties range from $50,000 to $1.5 million in fines and imprisonment of up to 10 years for a breach violation. Civil penalties range from $100 to $25,000 a year. But if there's a multiple year violation, the fines will go up. Some examples of privacy breaches. Talking in public areas, talking too loudly, talking to the wrong person, lost or stolen or improperly disposed of paper charts, mail, films, notebooks, laptops, PDAs, cell phones, media devices, zip disks, CD drives, flash drives, memory drives, hacking of unprotected computer systems, emails or faxes sent to the wrong address, wrong person, or wrong number, and users not logging off computer systems, allowing others to access their computer or system. Some top security issues that have been highlighted are a lack of security incident procedures, lack of security awareness and training, lack of access controls, lack of information access management, and lack of workstation security. This chart shows a breakdown of breaches, and it covers from September 2009 to September 2011, where about 50% were due to theft, 20% were due to unauthorized access and disclosure, 15% for loss, 7% for hacking, 6% for improper disposal, and so on. But what was hacked, lost, stolen, or inappropriately viewed? Here is by types of media. So paper charts or paper files, 26%. Computer stuff, laptops, 23%. Computers themselves, like desktops, 16%. Network servers, 10%. Other portable devices, 10%, and so on. Now, this chart shows under federal law how breakdowns for violations and imprisonment go. And if you didn't know about it, and the office is exercising reasonable diligence and corrects the breach within a considerable amount of time, a reasonable amount of time, there's no penalty. If the staff did not know about the breach and is doing due diligence, but did not make any attempts to correct the breach within a reasonable time, it can go from anywhere from minimum penalties up from $100 to $25,000 and maximum of $50,000 up to $1.5 million. If we look down at the bottom, if there's willful neglect and it's not corrected within the reasonable time frame, we're looking at $50,000 up to $1.5 million. So what is Texas trying to do? Texas is saying, hey, there's still too many breaches of information. It is not doing what it's supposed to do, so we need to do something to protect our citizens of the state of Texas. So the legislature came up with Texas House Bill 300, and it passed unanimously by both the House and the Senate and was signed into law last year. It went into effect September 1. The bill places stricter requirements on patient health, privacy covered, and covered entities. It redefined what a covered entity is and also expanded who a covered entity is. Who's a covered entity? Any person who assembles, collects, analyzes, uses, evaluates, stores, or transmits private health information for commercial, financial, or professional gain, monetary fees, dues, or on a cooperative, nonprofit, or pro bono basis is a covered entity. Any person who comes into possession of private health information is a covered entity. Any person who obtains or stores protected health information is a covered entity. Any person who is an employee, agent, or contractor of any of the above, insofar as the employee, agent, or contractor creates, receives, obtains, maintains, uses, or transmits protected health information, is also a covered entity. So basically, if you touch health information, you're a covered entity. Well, who's exempt? There's got to be some exemptions, right? Workers' comp. Workers' comp plans and the people who administer work comp plans are exempt. Employee benefits plans and those who administer them are exempt. Educational records covered by the Family Educational Rights and Privacy Act are exempt. Non-profit agencies who pay for the care of indigent people, but whose primary business is not the provision of health care or reimbursement for health care. processing of certain payment transactions by financial institutions are exempt, and certain information relating to offenders with mental health impairments are also exempt. Just because you're complying with federal HIPAA laws does not guarantee that you're complying with Texas privacy law. For example, Texas law covers more entities. Texas law protects more information than what was defined as PHI under HIPAA. Texas has its own training and notice requirements. Let's look at the components of House Bill 300. House Bill 300 outlines training, access, AG enforcement and penalties, AG website reporting requirements, sales of private health information, notice of electronic disclosure.
Screen sharing is paused. Click on the selected application to begin sharing. Screen sharing has resumed.
I apologize about that. Notice of electronic disclosure, HHSC audits, HHSC standards for electronic sharing, and create a HIT task force. Training. All covered entities under Health and Safety Code, this is a broader group under HIPAA, must train their employees. Training standards are stricter than those required by HIPAA. Training must include HIPAA and the Texas laws, which we're covering right now. And under HIPAA, it says employees are trained within a reasonable period of time after hiring and on any material changes in privacy policies or procedures. But under House Bill 300, states training must focus on specific business of the entity, the employee's scope of employment, must be done within 60 days of employment, must be repeated at least every 2 years. And the employee must sign an attendance statement and records must be maintained by the office. Access. If a healthcare provider uses EHR, which is an electronic health record, you must give access to the patient in electronic format. Similar to HIPAA requirements, but now under House Bill 300, this must occur within 30 days, or within 15 days instead of 30 days. And it incorporates HIPAA's exception to the access. HHSC, which is the Health and Human Services Commission, which is a state-level organization, can recommend a standard electronic format for release of this data. The AG has enforcement and penalties outlined. There's new penalties for wrongful disclosures similar to HIPAA and high-tech penalties. $5,000 for neglect, $25,000 if you knew about it or was intentional, $250,000 if it was done for financial gain. And there's limited fine for encrypted data sent to another covered entity for payment, treatment, or healthcare operations, or there's no further disclosure, or policies were in place. So those are the exceptions. Court penalties can go up to $1.5 million. And there's the AG can retain part of the penalty. So there is their enticement for monitoring this, or motivation. Something that will help out healthcare providers to mitigate factors for certain penalties. Being able to prove the existence and use of training programs such as this one, use of encryption for storing or transmitting electronic patient health information, and the covered entity's ability to demonstrate that it has security policies developed and maintained at the time of the breach.
Screen sharing is paused. Click on it. Screen sharing has resumed.
operations, which is PTO. Other than this, fines are determined by the seriousness of the violation, covered entity compliance history, whether the violation poses a significant risk of financial, reputational, or other harm to the patient, the amount necessary to determine future violations and covered entities' efforts to correct violations. The AG is required to maintain a website and report to the legislature. The website is to outline consumer or patient information and advice on privacy, to advise consumers and patients about their rights, and to list agencies affected. The AG is also required to report to the legislature the number and type of complaints that they receive, what agencies were involved, and the result of any actions taken. House 300 further outlines that the sale of protected health information is to be prohibited. No covered entity may receive direct or indirect remuneration for disclosing private health information. Now, disclosure for payment of treatment or healthcare operations don't count. So if they get to disclose your information to get your bill paid. Disclosure is required by law, don't count. Insurance or HMO functions also don't count, but involve reimbursement or limited costs. If you EHR, you must advise and provide written notice if an individual information is subject to electronic disclosure. So with House 300, you may need to update your notice of privacy practice unless it's already taken there that you use EHR. Texas data breach notification requirements were changed to apply whether the victim is a resident of Texas or a resident of a state without a data breach law, and the breach occurs here in Texas. The covered entity must provide written notice if an individual's information is subject to electronic disclosure. And except for PTO or disclosure required by law, you cannot disclose the patient's information without authorization for each electronic disclosure. And this can be done well. And just make sure you notate that verbal authorization is used on such and such date. And the AG is required to adopt a standardized form for the sharing of records. HHSC, which is the Texas Health and Human Services Commission, in connection with the Texas Health Services Authority, the AG's office, and the Texas Department of Insurance can request federal health and human services to perform an audit of the covered entity. And they shall periodically monitor and review the results of any audits that they request. If the state level HHSC has evidence that a covered entity has engaged in violations that are egregious and constitute a pattern of practice, they may require the covered entity to submit the results of a risk analysis, or they can, if a covered entity is licensed by an agency, request the licensing agency to perform an audit of the covered entity, and quite possibly lose the license to do business in the state. HHSQ standards for electronic sharing, where the Texas Health Services Authority is to develop, and the HHSC is to approve privacy and security standards for electronic sharing of private health information. And it's going to be HIPAA-based, and it should support interoperability of EHR systems. The AG is to appoint a task force, a HIT task force, which stands for Health Information Technology. AG is to appoint an 11-member task force to review health information technology issues, comprised comprised of 2 doctors, 2 hospital reps, 1 private citizen, and 1 pharmacist, and whoever else the AG appoints to it. They're to develop recommendations for electronic exchange, improving patient access to electronic patient information, and report to the legislature. Why is this occurring? Why do we have to do this? Well, let's look at some of the breaches that have occurred recently. Providence Hospital was hit with a $100,000 fine and a 3-year cap and required to do internal monitoring. They lost backup tapes and laptops because they were left unattended, and it affected 350,000 people. PBS, they were hit with $2.25 million in fines and another $1 million in restitution, and required to do external monitoring because they were improperly disposing of prescription bottle labels. So if you got a prescription filled at CVS, you never went and got it. They restocked the medicine, they just tossed your empty pill bottle in the trash. And then ended up in the landfills. And it has all your patient information on there. UCLA was hit with $865,500, a 3-year cap in external monitoring because of impermissible viewing of private health information. And this involves some celebrity records. And also some of the people that viewed the records were convicted and sent to prison. Mass General was hit with $1 million, a 3-year cap with internal monitoring, because they lost 192 paper records. But this included individuals' HIV information. And it had to do with alleged overall issues with policies on transport of records to off-site storage. Anybody have any questions?